Hello everyone, I am Dr Imran Shaikh. I am a consultant surgical gastroenterologist working at PD Hinduja Hospital, Mahim, Mumbai. I am expertise in hepatopancreatobiliary surgery, GI cancer surgery, and advanced laparoscopy and robotic surgery. Today we are going to talk about the pancreatic cancers. Pancreatic cancers are very aggressive type of cancers and they arises from a duct epithelium of a pancreas. That means there is a pancreatic duct which has got an internal lining and most of the cancers arises from them. 90% of these cancers are aggressive type and only 10% of cancers are better type. They are also called as neuroendocrine cancers or the cystic neoplasms of pancreas. Why this cancer happens? There are these factors. The most important of these factors is age. As the advancing age, the risk of cancer goes on increasing. But there are some other factors like high intake of alcohol and the smoking, tobacco chewing are the most important of these factors for the pancreatic cancers. Other than that, the Western lifestyle, sedentary lifestyle, obesity, these are also few risk factors. Most importantly, recently detected diabetes and not getting control, or diabetes which was initially controlled now not getting control, is also important risk factors and can be diagnosed by controlling or taking the sugar reports. Pancreatic cancer patients present to the hospital either by loss of appetite or weight or rapidly progressive painless jaundice, which can be seen by yellowish discoloration of eyes and yellow urine. So once the patient presents to the hospital, they also do have symptoms like the pale color stool, loss of appetite and loss of weight. Once we suspect this kind of cancers, we always order the investigations to confirm them, and the most important investigation being a contrast CT scan of abdomen and the pelvis. This is a special CT scan which can diagnose these pancreatic cancers, where we have to take thin cuts from the pancreas and we can diagnose them in early stage. As soon as we diagnose them, we also do something called as a tumor marker, which is a circulating tumor marker, can be diagnosed in a blood test. Most of these patients are jaundice because the cancer arises in the head of the pancreas, and we try to put the endoscopic stent to this patient to relieve the jaundice. But putting a stent is not a treatment. If these patients are operable upfront, we should always offer them a surgery. There are three parts of pancreas: the head, body and tail. The most of the cancers, 70% cancers happens in the head of the pancreas, and that's why they present early with the jaundice. But the cancers of pancreas which involve the body and the tail, normally they don't produce symptoms and they produce late. As we are lucky to get the head pancreatic cancers more and symptoms more, we diagnose them early. And as I discussed, the surgery remains the mainstay of a treatment. As far as possible, when we take the multimodality treatment, where surgery is the backbone of a treatment, along with that chemotherapy and rarely radiotherapy may be needed. To remove these pancreatic cancers from its head, we have to perform a complex surgery called Viper surgery, where we have to remove a head of the pancreas along with some part of our intestine, stomach, as well as the gallbladder and the bile duct, and we have to do a complex reconstruction. But being a major surgery, it is a very common surgery and is routinely performed at Hinduja Hospital. The success of this surgery and results are exceptional because nowadays all these surgeries we are performed laparoscopically and robotically. So my message to all is, if we want to avoid pancreatic cancers, the most important risk factor is the smoking, and if you avoid the smoking, almost 25% chances that risk may come down. Also, heading to the healthy lifestyle like avoiding alcohol, smoking, outside food, red processed meat can also be helpful in avoiding these pancreatic cancers. So stay healthy and stay safe.